Well, hello, we're here with Dr. Larry Klein of St. Petersburg, Florida. Dr. Klein, thank you very much for being with us and sharing your time with us and talking about your dental practice here in St. Petersburg. I'd like to know what differentiates you and your practice and your office from other offices out there and what people really should know about what you do and how you handle your patients.
I think that's key, right, what you said, how we handle our patients. I'm going to make the assumption that quality dentistry is the most important thing. So I'm going to make the assumption that you're coming to get not good work done. Now, what differentiates me from someone else is I hope that I can treat you with the type of respect and kindness, not only myself, but my entire team, that you feel comfortable not only coming back in here and having treatment done, but that you want to refer your friends and your family.
Well, that makes a lot of sense. I know that when I'm at a dentist, sometimes I want to talk because I actually feel like I'm sharing part of my life with my dentist and my oral hygiene person that's cleaning my mouth, and it seems to be much, much more, especially with the amount of time that you spend, and it's very sensitive, sort of somebody being in your mouth also.
One of the other things that really comes into play there is we see a lot of very scared patients, very phobic patients, and I actually enjoy seeing that. That makes me feel successful if I can take someone from being totally afraid of the dentist to now, okay, it's not as good as sitting on the beach, but it's still an experience that they were able to make it through, and we pat ourselves on the back, maybe even laugh afterwards. So treating the phobic patient is somebody that I really like to be able to deal with, and in doing that, it does take, sometimes you have to, instead of look with just your eyes, you have to look with your ears. You've got to listen to them, and as the saying goes, you got 2 ears and only one mouth. So sometimes we need to use both of our ears and actually listen to what the patient's concerns are, what their problems are, and then that helps me formulate what is best for the patient. So sometimes, even though there may be a better treatment, okay, the best treatment may not be for that patient. It may be the best treatment is something else that really dictates that they've decided that they really are concerned about. And I could give you an example if you'd like.
Yeah, please.
Let's say a patient comes in and they are missing a tooth, okay, and they're 95 years old, okay, and the best treatment would be to do a lot of extensive work, okay, implants, grafts, all these things that are wonderful things to do. But the patient is 95, they're in poor health, and even though that would be the best dental treatment, that may not be the best treatment for them. They may be better served by having some other treatment, would be more conservative, less expensive, and put them through a lot less trauma to accomplish that.
Well, excellent. Dr. Klein, thank you very much.